I ended up getting pregnant again, and then I was using them through my whole pregnancy, and I didn't receive prenatal care. And he was born and he's fine and everything, but a week after I had him, the SS let me bring him home and everything, and then a week after I had him, I relapsed really, really bad, and I got really messed up, and they took my kid.
The opioid epidemic has taken a toll in rural areas, especially on pregnant women. Doctors and healthcare providers in rural North Carolina are on the front lines trying to improve outcomes for mothers and babies.
We have certainly seen the effects of the opioid epidemic in rural Western North Carolina. And I think one of the populations that is starting to get a little bit more attention and that we are starting to more appropriately treat for opioid use disorder are pregnant and postpartum women.
In a way, pregnancy motivates women who struggle with addiction to get help.
The opportunity that we have when someone is pregnant or postpartum is unique in that they are highly motivated to take care of themselves, to have a healthy pregnancy, and to be the mom that they know they can be. That moment is a time that we could really capitalize on engaging women in treatment, developing a recovery plan, and helping them break the cycle of trauma, poverty, addiction, really changing the course of their life and their children's lives.
But barriers to care are rampant in rural areas.
Transportation has definitely been hard for me because right now I don't have a car, so I've been having to ride the transportation, and it's just been really hard, scheduling appointments. And if they can't get me to an appointment, then I can't go.
People who don't live in Appalachia maybe don't know that when I say someone's driving 40 miles away to get care, that there's usually a mountain in between and a 2-lane road to access that. So it changes what that transportation and access looks like in reality. One of the other challenges that pregnant women with opioid use disorder face in a rural setting is certainly access to medication-assisted treatment and access to the different types of medication-assisted treatment. So buprenorphine is a medication that can be prescribed by someone like me who's in the primary care setting, and that can be done in a regular office, whereas methadone, that is also standard of care, can be offered only at a methadone clinic or an opioid treatment program. And so when we look at access, not only do we have to look at our number of buprenorphine waivered providers in a region that serve pregnant women, but also the availability of methadone clinics to support those women if buprenorphine treatment is not right for them.
Healthcare providers are working hard to remove those barriers. One approach is bringing addiction treatment and prenatal services under one roof.
They can see a provider like myself who is buprenorphine waivered to prescribe medication-assisted treatment. So that means when you are coming to see me, you're coming to see me to get your obstetrical care and your medication-assisted treatment in the same visit. You don't have to go to another clinic to access that. You can attend one-on-one individual sessions with our counselor or attend our groups, right? And that's a game changer.
As anyone who's ever been pregnant knows, you have to go to the doctor a lot. And so if you are someone with a limited income, maybe limited money for gas or unreliable transportation, the ability to come one place and get money through WIC for your food so that you can eat enough and have a healthy pregnancy, to see your behavioral health clinician if you're struggling with postpartum depression or a mood disorder, to see an addiction specialist and a doctor who can prescribe medications to help you with your opioid use disorder, and to get transportation vouchers so that you can get back and forth from your home to those visits. To have that all located in one place it's really special to be part of a team like that, and it really improves access to care for patients and health outcomes.
April says the program has helped her. She's been able to stay clean throughout this pregnancy, her 7th.
I've been through a lot. My mom overdosed, and then I lost my son, and that was a lot for me to handle because I really didn't know how to handle that. So I did turn to drugs, and I was hanging out with the wrong people. I was just staying high all the time and constantly seemed like I was constantly staying pregnant, and I just want my kids, to be a mom to my kids and not make the same mistakes that I did in the past, because I honestly don't want to end up like my mom. She was 45 years old and overdosed, and it was an accident, I'm sure, because shouldn't mean to or whatever. But, I don't want to end up like that.